From a community health perspective, I see health literacy issues all the time. While working in the community, usually taking blood pressures, I usually have a lot of people come up to me and say, "Can you check my blood?" And they just throw their arm out, and I don't think sometimes they know the difference between getting their blood pressure taken and getting their blood drawn.
Healthcare today is complex and downright overwhelming for many of us.
I felt like he didn't give me enough time to maybe comprehend what he had to go to the next person.
Take 1 tablet by mouth once daily for 7 days, then 2 tablets once daily. So am I supposed to take 1 tablet or 2 tablets?
I left there feeling like, what have I learned? What can I do?
I don't even understand what they're asking right now. How am I supposed to fill this out?
I didn't go to medical school. I'm not a doctor. I'm not going to look up this on the internet. I am going to trust that you're going to guide me through this process.
When you speak to patients and families, do they really understand what you are saying or asking them to do?
When she told me the name of it and told me what caused it, I was in la la land.
As healthcare providers, we are here to help, but we may be harming patients by making assumptions about their education, their ability to read, and how well they understand English.
Often people do not understand what's wrong with them and what they must do to get better. Medication errors are common because patients get confused by directions and may be too embarrassed to ask any questions. These are examples of low health literacy, which 9 out of 10 people have.
Recently, I was working with a patient. He shared a personal story with me that he was diagnosed with high blood pressure and he got his medicine, but he just stopped taking his medicine because he didn't understand why he needed it or why he had to take it. And then 2 weeks later, he had a stroke.
To help people understand, we need to use universal precautions and assume that everyone has a low health literacy.
I like to think I'm a pretty intelligent person, but sometimes I'm just not on the level that the physicians are on, so I'm a little lost when they use the terms that I've never heard of.
Someone may be well educated, yet unable to understand health-related information or instructions given. Invisible factors like stress and anxiety can impact one's ability to understand. Keep it simple, since everyone benefits from clear, concise communication.
In communication with a patient, you have to understand where that patient's coming from in some way.
Think about the words you use. If you say hypertension, are you sure the patient knows you mean high blood pressure? If you say avoid salt, do they know sodium is what they need to look for on food labels? Should you use the word arthritis or say pain in your joints?
Instead of telling me I had a rash, they told me I had pseudoflictulitis.
When I used the word blood pressure and then went back and used the word hypertension, the patient thought that I was saying that he was hyperactive instead of having high blood pressure.
Encourage your patients to bring family and a friend to appointments. In addition to providing emotional support, that person can take notes, ask questions, and help the patient understand.
When you're in this situation, you really don't know what questions to ask. But if you have someone with you, then they can sit back and, I would say, analyze the situation better.
Research suggests that patients need to understand 3 basic things during a healthcare visit. 1, what is wrong with me? It's best to keep that answer brief. 2, what do I need to do to help myself? For instance, do I need to take these medications? And 3, why is it important that I do this?
Don't assume that you've gone through your spiel and now everybody understands. They may not understand.
After you explain to the patient their problem and what the plan of care is, avoid using yes or no questions like, did you understand me? Instead, try the teach-back method, where you ask them to repeat in their own words what you've just taught them to see if they fully understood you. Keep trying until they can repeat it back to you and you're confident that they understood what you said.
Can you explain to me what I just told you?
Sure, we're going to go down to 30.
This is especially important when instructing patients how to take their medications. They need to understand what to take, how to take it, and how often they need to take the medication throughout the day. Also, do they understand the terms that we frequently use, like side effects or adverse reactions? Do they understand how to measure the medications and if they need to take it with food or beverage throughout the day? Our patients need to understand how to take care of themselves when they go home.
When giving a patient written instructions, make sure you use a 5th grade reading level. Use large fonts for seniors and use pictures whenever possible. Simple pictures hand-drawn at appointments can go a long way.
To help ensure patients understand exactly what we say, consider putting these points into practice. Assume everyone has low healthcare literacy. Use simple, clear words. Answer these 3 questions for the patient. What is wrong? What needs to be done? And why is it important? Use the teach back method and remember that written information and pictures are useful for patients.
Please slow down so that I can understand exactly what you are saying.
We're just everyday people who, we just want to understand the best way that we can. So just keep it simple for us. We won't be offended. We really won't. If anything, we'll be more appreciative that you're bringing it down to our level so that we can know where to go from here. So, just keep it simple.